listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static.
In today's episode, we're talking about 5-star Medicare Advantage plans. What are these plans? How did they earn their 5 stars? And is it true you can sell them all year long? We'll get into that and more on the Agent Survival Guide podcast. Start selling 5-star Medicare Advantage plans all year by Cassidy Potts. Medicare's 5-star rating system makes it easy for clients to compare plans and make informed decisions for their needs. Thanks to a special enrollment period, or SEP, your client can even switch to a higher quality plan outside of the annual enrollment period, or AEP. These SEPs are for 5-star Medicare Advantage, or MA plans. Every year, the Centers for Medicare and Medicaid Services use information from member satisfaction surveys, plans, and healthcare providers to rate MA and Part D plans on a 1 to 5-star scale. You can help your clients to easily compare plans with these ratings to find high-quality coverage. The star scale is broken into 2 categories: MA plans with prescription drug coverage and MA plans without, or MA only. Both categories are evaluated in a series of domains, such as staying healthy, screenings, tests, and vaccines, managing chronic long-term conditions, member experience with the health plan, member complaints and changes in the healthcare performance, and the health plan's customer service. For MAPD plans, there's an additional domain called drug safety and accuracy of drug pricing. A plan receives a score in each category, as well as a final star rating. 1 star represents poor performance, while 5 stars is given to excellent plans. Plans that receive lower than a 3-star rating for 3 years in a row are flagged by CMS and labeled as low-performing plans. Continuing to underperform may lead to a plan's removal from the Medicare marketplace. CMS releases new star ratings each fall. Medicare Advantage plans that are new to the market won't receive a star rating right away, since there isn't enough data on the plan's performance. I mentioned an SEP for 5-star plans earlier. If there's a 5-star MA, Medicare drug, or Medicare cost plan in your client's service area, your clients can switch from their current plan to that one using the 5-star SEP. They can only use this SEP once from December 8th to November 30th of the next year. Enrollments made from December 8th through December 31st are effective January 1st. Any enrollments after are effective the month after you submit the request. Please note that some SEPs now require CMS validation. When applicable, enrollments under these SEPs must take place through Medicare.gov or by calling 1-800-MEDICARE. Agents are still responsible for guiding beneficiaries, explaining available options, and helping to outline the next steps, even if they're not completing the enrollment. All of this may have you and your clients wondering if they should switch to a 5-star plan. Even though it may seem like a no-brainer to switch from a lower-rated plan to one with a distinguished 5 stars, that might not always be the right option for your clients. For example, if your client decides they want to move from an MAPD plan to a 5-star standalone Medicare Part D prescription drug plan, they'll be disenrolled from their MA plan and returned to original Medicare for coverage of their health services. Your clients might also run into trouble and lose their prescription drug coverage if they move from an MA plan that has drug coverage to a 5-star one that doesn't. In that case, they'll have to wait until the AEP or another SEP for drug coverage. This may even cause them to pay a Part D late enrollment penalty. With that in mind, we expect a more common use of the 5-star SEP would be a client changing their primary health coverage by moving from a lower performing MAPD plan to a 5-star MAPD plan. If the provider network and costs are still good fits for your client, it's a logical upgrade for them. Please note that 5-star plans should only be marketed in areas where they're available. You must follow all of the guidelines when marketing 5-star plans. For the list of essential disclaimers you must include, see the full article linked in the episode notes. This probably isn't the first time you're hearing about 5-star plans, but it may be the first time you seriously started thinking about marketing these options. So where should you get started? An easy way for you and your clients to find 5-star plans in your area is to use PlanEnroll. You can simply enter their zip code to compare top-rated plans in the area. We also suggest contacting our Ritter sales team for the quickest assistance when discovering these sales opportunities. Making sure that you have all the tools you need to provide quality coverage is our priority. That's all for today. We'll see you on the next episode of the Agent Survival Guide. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Cassidy Potts. Script adaptation, recording, and production by me, Jeff Snyder. Podcast design by Urban Rivera. Follow along with our show wherever you like to listen. Don't forget to help us out by rating and reviewing our show on Apple or Spotify. We really appreciate the feedback.